The first dengue pill human challenge trial offers hope for successful treatment. The first dengue medication seems promising in a human challenge study. Prior to presenting the research at the American Society of Tropical Medicine and Hygiene annual meeting in Chicago, the business said that there are presently no particular medicines for dengue, an increasingly serious disease concern. Data released by the business on Friday showed that a Johnson & Johnson dengue fever medication seemed to shield against a strain of the virus in a limited number of patients in a small human challenge experiment in the United States. Prior to presenting the research at the American Society of Tropical Medicine and Hygiene annual meeting in Chicago, the business said that there are presently no particular medicines for dengue, an increasingly serious disease concern. According to Marnix Van Loock, who is in charge of J&J's Janssen division's research on emerging infections, it is the first ever to show antiviral activity against dengue. In human challenge trials, scientists purposefully expose healthy volunteers to a virus in order to test a therapy or vaccine or to learn more about the sickness the pathogen causes. The term break bone fever refers to the extreme joint pain and spasms that some dengue fever patients may suffer, despite the fact that the illness is often asymptomatic. The chief scientist of the World Health Organization, Jeremy Farrar, stated earlier this month that the disease has long been a plague throughout much of Asia and Latin America, resulting in millions of infections and tens of thousands of deaths annually. Furthermore, he predicted that it would continue to spread as more areas become hospitable for the mosquitoes that spread it due to climate change. In the study conducted in collaboration with the Johns Hopkins Bloomberg School of Public Health, 10 participants received a high dosage of the J&J tablet 5 days before receiving an injection of a dengue strain. After that, they kept taking the medication for another 21 days. During the course of the 85-day monitoring period, none of the 10 individuals had any detectable dengue virus in their blood after their exposure to the pathogen, nor had they shown any indications of an immune response to the viral infection. Test results for 6 individuals in a placebo group who also received dengue injections revealed a detectable virus. When required, trial participants got regular treatment from medical experts, and a weakened form of the virus was utilized to reduce symptoms. The tablet is now undergoing Phase 2 studies to prevent the 4 main forms of dengue in an environment where the illness is prevalent, and J&J noted that the encouraging preliminary results support these efforts. Testing it as a therapy will be the next stage. The medication stops 2 viral proteins from doing their job, which stops the virus from replicating. According to J&J, every study participant accepted it well. In many of the low and middle income nations where medicine is most required, access to the new treatment will be a crucial concern for the future if it proves effective on a broader scale. This is similar to the problem the WHO endorsed earlier this month for the dengue vaccine. Van Loock said, "We're working on it, but it was still early.